Choosing the right Medicare plan can feel confusing, especially when you're comparing different options for your health care. Medicare is a federal health insurance program mainly for people age 65 and older, as well as some younger individuals with disabilities. Original Medicare includes Part A for hospital care and Part B for doctor visits, outpatient services, and preventive care. With Original Medicare, there is no yearly maximum out-of-pocket limit to protect you from high medical costs. For many Part B services, Medicare pays about 80% of the approved amount, and you are responsible for the remaining 20%. Because there is no spending cap, many people choose to add a Medigap or Medicare supplement plan to help cover those extra costs. Medicare Advantage plans, also known as Part C, are offered by private insurance companies approved by Medicare. Unlike Original Medicare, Medicare Advantage plans include a yearly maximum out-of-pocket limit for covered services. Most Medicare Advantage plans also include prescription drug coverage, while Original Medicare requires a separate drug plan. Many people are unaware that delaying drug coverage can lead to late enrollment penalties later on. Original Medicare offers more flexibility in choosing doctors, while Medicare Advantage limits your total yearly healthcare spending. The right Medicare choice depends on your healthcare needs, budget, and personal preferences. Understanding your options helps you make a confident decision. Many Medicare Advantage plans offer $0 monthly premiums. Choosing the right plan means making sure your doctors are in network and your current medications are covered. That's exactly what the Bennett Agency is here to help you with.